Well, the first phase of the research was where we now looking back on it, perhaps rather naively, but also relatively unsuccessfully, we tried to have an intervention that would help people improve their mental health literacy and prompt them into seeking treatment. So that's actually giving people an understanding of the symptoms, all the things that they were telling us about, and where to seek treatment or how to seek treatment for that. And what we found was that it didn't really seem to be having much of an impact. So we did a more in-depth study at a follow-up point of about 4 years of a series of really in-depth interviews, a qualitative study, to find out what was happening. And we found that people encountered many barriers when they did seek treatment, particularly barriers in terms of what we now call poor health literacy of the doctors, who would have a very biased view of what someone who has an eating disorder should look like. They should look very thin. So people were often told, well, you're not thin enough, was a very common refrain. And there was a high level of stigma, which really was across both stigma of having a mental health problem, but also stigma of having an eating disorder, and an eating disorder not being seen as a serious disorder, either in the general community or by healthcare practitioners. So those barriers that we identified, we wrote about in a paper which came out during the period of the funding, and has actually been very widely cited, because there's very few papers that have really pointed to the more, as I say, behind the scenes happening of seeking treatment